Well, there's a rumor out there, and we've got to get this cleared up. So, are women coming in now requesting smaller breast implants, Dan?
Well, I think there's an element of bias in my practice because I practice in Manhattan, and I think historically the size implants that we put in Manhattan certainly differed than the size that most patients requested in, say, Dallas or Seattle, where you guys are from. But I think there's no question that there's a trend towards smaller implants, and really that means is that people want a more natural looking breast. That whole idea, that concept of having an augmented looking chest, where you would see a patient on the beach or a woman on the beach with very artificial looking breast. I mean, that aesthetic idea, I think, has shifted to a much more natural aesthetic result.
Yeah, I think women want a more athletic look often, and you know, in Seattle, we're not really known for the huge implants as much as you might think. But what I am seeing is more and more women coming in who had their implants maybe 10, 15 years ago, downsizing now. Maybe they just say, it's just not me anymore, it's just not the look I want to have anymore. So I am seeing that trend to downsizing, and I think we're probably seeing a little bit smaller implants for the primary augmentation as well.
I think the other great thing about it, at least from a medical perspective, is that we know that the safety profile of a smaller implant is much better for the patient. I mean, the problems that you would typically see with a breast implant, let's say capsular contracture, which is one of the most common complications, skin atrophy or overlying thinning of the skin and resultant rippling. I mean, these things happen at a much higher incidence with larger implants. I mean, larger implants can be problematic for patients.
Absolutely. You know, you put so much stress on that tissue envelope that has to contain the implant. You get thinning, then you see rippling, you see the bottoming out, and you see all those problems from the heavy implants that are largely avoidable if you go a little bit smaller.
There's clearly variability around really the world. I don't think there's one aesthetic ideal, but again, you guys are probably communicating with your patients and really finding out what they want, and sounds like there maybe is a trend towards smaller implants. So if you want to see more of this, you can see it on the plasticsurgerychannel.com.